I just try not to think about health insurance. The more I think about it, the more I worry.
There are 47 million uninsured. It's almost embarrassing, this country that has so much ability that we can't figure out healthcare and get everybody covered.
Hundreds of dollars of everybody's health insurance premium is going to pay for the hospitalization of the uninsured.
What we're doing is learning lessons and creating the political environment at the state government, as well as the environment within the advocacy community for change to improve coverage.
My name is Lisa Santos. We're in Baltimore, Maryland, and I'm 28 weeks pregnant. After I have the baby, I really don't know what I'm going to do about healthcare after then.
Everything is at stake for them. People's lives depend on them being able to be healthy.
My name is Sean Rawson. My wife, she doesn't work. She stay home with the girls and stuff. At any given time, if I take ill, everything comes crashing down, and I lose everything.
Policymakers, our ability to get things done is really constrained, not just by finance, but by time. We're all grasping for solutions here. If these problems were simple, we would have solved them a long time ago. The work that we are doing and our colleagues in other states are going to push the federal government to act.
Our organization is a grassroots coalition of labor, business, faith, health, and community groups from across Maryland that really believe in healthcare. We started with the people of Maryland, building up broad popular support. Then we went to the policymakers and said, look, we have a proposal here that makes a lot of sense, and we have a broad coalition behind it.
We're trying to create the environments where states can make change. And that environment is dependent upon a couple of things. Government has to want to do the right thing. And advocacy groups and communities also need to be engaged so that that fundamental change can happen.
There's sort of a symbiotic relationship that exists between this administration and the private sectors, including the advocacy groups. We push each other along, and as we are pushing, coverage expands. And as a result, we now have a bill. It expanded coverage substantially to low-income parents and to small businesses who have had difficulty in providing health insurance for their employees.
So the small employer participates. They get some subsidy to help make the premiums affordable. There are probably about 4 states or 5 states who are doing this, and we're doing an evaluation of 3 of those states. We try to do evaluations that will be useful to develop policy.
Expanding coverage has to be based upon good knowledge and important learnings. What we do in our programs is to look at what happens in states that are experimenting and share that evidence with other states so that they can increase the number of kids who are covered and the number of parents who are also covered.
The place where I work, late street cycles, might get small business insurance. That definitely would help out a lot. I'm just hoping for the best.
We believe that the process we've created is one that can help other states achieve important steps toward healthcare for all and the goal of healthcare for all.
I still think the federal government needs to act, but as a result of the hard work that we've done here, 100,000 Marylanders are going to be better off, and that's nothing to sneeze at.